All right, Jim, thank you so much. Well, not many children are jumping for joy when it's time to head to the dentist, but for children with sensory sensitivities or autism, well, the actual experience, it can spiral into a full-blown nightmare. And that's why one office here on the Gulf Coast, well, they're taking extra steps to care for children with these sensitivities. And this morning we are joined by Dr. Douglas Keck, the dental director for Healthcare Network. Dr. Doug?
Yes.
Welcome. Thank you so much for joining us.
Thanks for having me, Alex.
You want to tell me a little bit about how you got this idea? I mean, as a former kid, I can say I was definitely afraid of going to the dentist.
It's not necessarily a new idea, but as a pediatric dentist myself, part of what we do as pediatric dentists is take care of children that have sensory sensitivities, as well as children that don't. It's just becoming a more common thing that I've noticed in dentistry. About 1 in 100 children worldwide have been diagnosed with autism. So treating and being aware of these issues is important.
Absolutely. You want to give me an example of what you guys do differently procedure-wise to make the experience a little bit more palatable?
Well, as a matter of fact, one of the things that we have done is written some grants to receive equipment that actually helps children with sensory sensitivities. There's a machine called the Vecta machine that's used commonly at Golisano Children's Hospital and for other children in pediatric offices. It's a machine that can be moved from room to room, that has bubbles in it, or can play something on the ceiling that helps relax children. We also have objects that they can hold that helps with stimulation and anxiety. Dimming the lights can help these children. And one of the big things with kids that have autism or sensory sensitivities is the feelings that they get from their different senses, obviously. Bright lights, loud sounds, the different tastes and textures, and even the smells of a dental office can be overstimulated.
Yeah, very overwhelming experience, even as an adult going to the dentist. That was the big thing I wanted to ask. I mean, I know light sources from, a dental perspective are very important to be able to work inside the mouth.
Right.
How do you balance your ability to do that work while also not blinding or overwhelming the child in that way?
Well, one of the things that's very important with behavior guidance of children is the tell, show, do method, which is obviously telling the children what you're going to do, showing them, allowing them to touch or feel the instruments, and then actually doing it. So the long and short of it is the light can be dimmed. You can still have the overhead light, but mostly talking and communicating and allowing them to experience things is the easiest way to positively reinforce them.
I'm sure you've put a lot of parents' minds at peace with what you do.
Well, hopefully, and I think that's a big thing with pediatric dentistry and dentistry in general is communication, whether it be with the patient or the parent.
Absolutely. Dr. Doug, thank you so much for joining us here.
Thank you.
And of course, if you want to make an appointment for your child, well, all you have to do is call the number on your screen. Healthcare Network does both pediatrics and adult dentistry, and you can learn more about how Healthcare Network goes above and beyond for all children. That's all going to be on the Gulf Coast News app. We're going to be right